Hello, everybody, and thank you for joining me in this fabulous workshop. This one is titled How to Treat Hyperpigmentation with Confidence and Success. And my name is Natalia Cosentini. I work for a company called Euro Essential, where I am the resident master educator. And of course, we are here to discuss this in the confines of what the Dr. Schramek cosmetic line is able to offer you as a pro person, a person who's going to be working with the product, and of course for your client as a home maintenance. But this is of course all in an idea of how to treat pigmentation with confidence, with success, how to recognize where the problems lie, and how to coach our clients through some of the probably most difficult times they're going to experience with their skin, which pigmentation can be pretty troublesome. So let's take a look at some of the kind of basic information about hyperpigmentation. So of course, as we know, hyperpigmentation can be limited or extensive. Some clients may come in and complain about one or two spots they wanting to treat, and other clients may come in and of course you see big patches of melasma on their skin, and this is of course a situation where the treatment can be quite difficult. So for many affected persons, hyperpigmentation means that they do have a heavy burden. Typically, when you're looking at somebody's skin with hyperpigmentation right away, optically, you can judge their age to be actually much older than the chronological age, which many of our clients actually feel that hyperpigmentation contributes greatly to the appearance of their youthfulness and, of course, the attractiveness of the client. So we definitely are wanting to help these type of individuals. We're wanting to offer them treatment either in cabin or at home that will be definitely integral to their success. Now, when it comes to treatment of hyperpigmentation, treatment in our aesthetic room and treatment outside of it will be equally as important. So for hyperpigmentation, where does it come from? What really is it? It's a big umbrella term, but really, what do we recognize as hyperpigmentation? Well, it is an overproduction of certain type of agent. This agent is actually a protein called melanin. It appears to be reddish, brownish, or black in pigmentation, depending what form of melanin this might be. Pigmentation that is melanin is probably one of the most protective mechanics that skin is able to produce by itself, and it really does serve to limit some of the interaction between our DNA structures within our cells and of course the damaging UV rays. So we know that melanin is produced in other areas of the body, not definitely just in the skin, which is predominantly the epidermis, but also in retina of the eyes, for example. So that's something that we kind of take a little bit of a note of. And of course, what causes the pigmentation to be produced, or what is the factory behind it? It is the cell that's called melanocyte. And of course, this cell is located at the very basement of our epidermis in the basal layer. That's where it resides. And it sort of resembles a little bit of like a upside down or outward stretch fingers in a hand. So this is a cell that actually does have these protrusions. Those protrusions are able to interact with keratinocytes at a ratio of about 1 melanocyte to 36 keratinocyte cells around it. Of course, depending on what skin type we are, this ratio does not really change, but the behavior of the melanocyte and sometimes even their appearance may be different between light skinned individuals and dark skinned individuals as well. One other aspect of melanocyte activity to remember is also the fact that they are very often involved in immune functions of the skin. So that means that the production of melanin within them can be initiated as an inflammatory process ensues in a skin, and especially if the inflammation is actually allowed to remain in a skin for quite a long time. So what's normal, what's not normal? Where do we know what to treat, and where do we know what to sort of tell our clients that, you're really out of luck here. This is something that you were born with. So these are the ideas of facultative versus constitutive pigmentation. Facultative pigmentation, of course, will be anything that has to do with the kind of your birthday suit color you were born in. whether you're a light-skinned individual, dark-skinned individual, the color of your hair, the color of your eyes. Of course, we cannot do much to change it. Of course, you can bleach your hair, you can color your hair, but there isn't really much that you can do about something like eye color. Of course, other things that contribute to, what we recognize on the surface of the skin as being facultative pigmentation is something like freckles. So this is, of course, seen in many, many of the individuals out there of Nordic descent, or even somebody who may have a darker skin. And this is definitely a mutation in a specific gene that's responsible for production of melanin, or triggering production of melanin. When we're talking about constitutive pigmentation, of course, this is pigmentation that's acquired as a result to exposure to different factors. In the most prominent, probably, factor that influences the pigmentation rates is, of course, exposure to sunlight. So we all know this. This is what we communicate with our clients very easily. Of course, if client comes in with freckles and wants the freckles to be reduced or gone, well, that will never be a situation that we can bring them to. However, if a client has an acquired constitutive pigmentation they would like to lighten or correct, we can definitely offer treatment for that. So some examples of these type of hyperpigmentation ideas of inherited ways or acquired. In an inherited type of umbrella will be something like navy. Navy are, of course, any type of birthmarks that you can observe on the skin. This could be something like a mole, or perhaps a little kind of cluster of capillaries that can also occur. And of course, there's other ones that relate more to the brownish type of pigmentation in the skin, which is cafe au lait spots and ephialides, freckles. So this is actually something that a lot of the times clients will say, oh, I've had this since I was a kid. It's, or I had these freckles and they come a little bit more intense in the summer, and then of course, lighten during the winter. So those are things that we can typically right away relate to a specific genetic predisposition. However, in the acquired realm of hyperpigmentation, we do have things that predominantly will bring your client into the treatment room. So age spots, melasma, post-inflammatory hyperpigmentation, or for short PIH, friction-induced hyperpigmentation, so in skin folds, or where some areas of the body actually meet, like armpits or in a groin area. And of course, in some cases, this is an effect of exposure to an agent that then causes a lot of pigmentation as a post-inflammatory pathway is created. So Barlow dermatitis and meadow grass dermatitis. So let's take a look at all of this a little bit more in detail. Just to kind of, before we move on, reinforcing the idea that only acquired hyperpigmentation can be treated at any given time. So let's look at causes. So causes of pigmentation where there's direct link between the cause and, of course, the subsequent development of pigment. So UV exposure, right away, we know this is the factor that definitely influences or triggers, even in some cases, the production of pigment. So UV exposure does one thing for our body. It actually initiates the release of alpha MSH, so melano-stimulating or melanin-stimulating hormone. This is a precursor to the function within the melanocyte that will be that factor of pigment production. So light-sensitive medications, antidepressants, HRTs, the pill, even some natural medications that some clients may be on, like St. John wort, that very often is being given for management of anxiety and depression. You will notice that these type of things, when ingested, when they actually enter your system and when they do what they're supposed to do, they also do leave our skin quite vulnerable to exposure to sunlight. So that is definitely one of the things to remember. Essential oils. Many of us think, oh, essential oils are great. They, do have functionality in our body to some extent, but many of them can also be quite photosensitizing when left on the skin undiluted. So phototoxic plants, of course, we know that something like giant hogweed, for example, which that has been written on across GTA, especially here in Toronto, we did have a problem with that. You can notice that one of the things that it does propose to you is this blistering type of effects when you come in contact with some of the actives in the plant, and then that of course turns into a blistering kind of hivey situation, and then of course leaves some marks of post-inflammatory pigmentation on your skin. So those are pretty much some of the things that will be direct causes, but in some cases there could be even self-imposed causes like improper skincare, so causing barrier disruptions in the skin, where that leads to hyperpigmentation. I have discussed that in my sensitive skin dilemma portion of the ESI classes. So if you haven't watched that, you can also go and revisit that. And of course, improperly directed chemical peels or clinical skin abrasions. So something that was definitely applied to the client's skin or performed on the client's skin, and it kind of passed that threshold of where the skin was happy with it. And of course, then involved the hyperpigmentation, inflammation to hyperpigmentation pathway. So triggers for hyperpigmentation, so things that maybe you're more predisposed to or not, but there are triggering factors that can bring on bouts of pigmentation. So we all recognize hormonal influences as being one of them. Of course, genetics. So what Fitzpatrick classification you have, clients or individuals with darker skin are definitely more prone to suffer from the displeasing kind of effects of hyperpigmentation. Inflammation left unchecked for a long period of time will definitely sometimes cause the pigmentary changes. Stress, so heightened levels of cortisol can definitely, send the wrong messages to the skin. Oxidation, so breakdown of cells. This is usually something that's relative to a disease, and then skin infections and sometimes injury. So keeping all of this in mind, of course, when we're looking at the types of hyperpigmentation that we are able to get in our skins, one of the probably ones that are more related to a progressive age is age spots. And in this situation, this is actually a more of a combination between some of the pigmentation that is involved in production here over periods of time as an exposure to sunlight, but also the fact that there are some various metabolic waste products that accumulate within our cells. So in this actual particular case here, one of the things that we are exposed to is the overabundance of lipofusine. This is a type of lipidic material that's left after metabolism of different type of fats. And of course, your cell recycling plant is no longer functioning well after a certain age. And that waste material, instead of being carried out of the skin and broken down, it is rather accumulated around and causes this kind of annoying, very recognizable spots, sometimes called solar spots or liver spots as well. So lipofusine, if you notice here, it is actually something that accumulates right within the cells. You can see it in some of those microscope enhanced pictures over there. It is composed of lipid containing residual type of, liposomal digestion within the skin. It appears to be a product of oxidation of unsaturated fatty acids. And of course, it develops to be a non-reusable, non-degrading, or hard to dispose of type of material that is very, very difficult at some age to get rid of, to eliminate from the cells. So it kind of saturates around the membrane of the cells and lingers around, so giving us that displeasing appearance of sunspots. Then, of course, there is melasma. Melasma and post-inflammatory hyperpigmentation very often do have the same mechanics. However, the triggering factors or causing factors may be different. Melasma in particular is categorized by patches of discoloration or that type of limited diffused pigmentation that you can see on the, on the picture there on the right hand side in the upper image. So it typically occurs on the face and it is symmetrical in appearance. So that means if it occurs on one side of the face, typically it will actually appear on the other side as well. This is, of course, an area of the body that is exposed to the sunlight the most, and that would be one of the triggering factors for melasma development as well. So estrogen and progesterone, when it actually relates mainly to females, it is something that is associated with this condition. So the spikes in some of the hormones, the inability for your body to sort of mitigate or as an effect of something like pregnancy, it will definitely produce, in some cases, the accumulation of pigment. So some clients who are definitely sensitive to these type of hormones, if they are on HRTs, so hormonal replacement therapies, or perhaps a birth control pill, they may also produce these type of visible lesions. So other triggers, and this is actually something that has been discovered recently, is dilated capillaries in the form of that diffuse type of malar distribution of melasma that you see in the upper right image. There is a lot of the times also very visible network of dilated capillaries that actually give you an effect of interaction between the pigment as well as the plasmin, so one of the main components of blood. Melanocytes, for whatever reason, we don't understand the mechanics of it just yet, but they do get triggered by the abundance of plasmin within the tissue. So one of the things to also remember when it relates to melasma is that it can be irritated with use of cosmetics, with any type of irritating ingredients, and also the presence of visible light. So very often our individuals that treat melasma will be very, very good at using sunblocks, SPF products, but sometimes they forget that you can also help with the situation if you filter some of the visible light spectrum by using things like blemish balms or foundations equipped in mineral content of iron oxides and other type of mineral substances. So obviously, what can we do to minimize the chances of, either rebounding pigmentation or pigmentation appearing in the first place? One of the most obvious things is to, kind of filter that UV exposure. Obviously, being a nocturnal creature is not the option here for most of us, but really knowing how to protect your skin. So that means that if you're definitely getting in and out of your car all day, even if you're staying indoors most of the time, you still need some degree of sun protection. And of course, if you're planning on being outdoors for a long period of time, the measure should be even that much more severe. So that means that you should also probably use a clothing that is more protective, or even use of a hat to protect your skin from exposure to sunlight on the face. So that will definitely contribute to the success. And of course, other important measures when it comes to talking to the clients, especially about the management of their hyperpigmentation lesions, is to manage their client expectations. In some cases, we can, of course, help them get rid of the pigmentation completely, but in some cases that may not be available to us because there are triggering factors that come from the internal components. So things like hormones or stress. Stress, of course, you can manage stress to some degree. A lot of us are very good at, giving our bodies a little bit of a break, whether it's through a walk that you take or a meditation class, whatever it might be. You can definitely lower some of the effects of stress. But have a discussion about what products to use and what products to avoid. Even if your client is using something that can be irritating to the skin, that can involve later on some patches of pigmentation. This is probably one of the most common culprits here, would be things like denatured alcohols or fragrances. It doesn't matter whether the fragrance is, natural, or, as you notice, most of natural fragrances will actually come from essential oils, or whether the fragrance is from a synthetic source. A lot of our clients will over time become definitely sensitized by the presence of fragrance. So assess their medication. Clients may wish to consider alternatives if they discuss it with their doctors. Of course, what is appropriate. We never discourage anybody from discontinuing their prescriptive medication, but maybe a gentle coaching to go back to your doctor and see if there are alternatives that you can be on. So those are the things to kind of measure with your client and offer a little bit of help along the way. And of course, there always is the capability of building a good quality skincare routine. So for Dr. Schrammek, this particular line of products that kind of gives you this potential is Mela White series. Special type of products that are there to even pigmentation, They can precisely help to intervene in some of the process of melanogenesis. They help to prevent the formation of hyperpigmentation as well. And they can brighten your complexion pretty much on contact. We also, in the Dr. Schrammek line, do not use any of the burdensome type of ingredients like hydroquinone or kojic acid. So there's actually no AHAs in any of the products, because a lot of those over time, overuse for long periods of time, can also contribute to some of the disrepair in the skin, then inflammation, then pigmentation as well. So overall, very gentle formula, very optimally tolerated by most skins. Highly effective ingredients as well. I will talk about the ingredients in a moment, but they are there to really harmonize the skin tone for you. So we also do have other additional actions in most of the product, and that is, of course, the nourishing and the calming action. So let's take a look. What type of options do we have? So I don't really have every single product on here. There are far more products out there, but one of the ones that are more popular in the range are definitely the night cream. The night cream is really here formulated in a gel, kind of velvety, soothing type of overall texture. It does offer you a brightening component, and it does offer you an anti-aging angle from regenerating and calming. So if you notice, there is actually a lot of ingredients here that I mentioned. Some of them I will go a little bit more in detail later, but we're going to talk about vitamin C. Hexyl resurcinol is also a very interesting ingredient. It is a peptide that can regenerate the skin or help some of the movement of skin cells in the epidermis. We're going to look at diacinamide in a bit more of a magnifying glass in a moment. And there's also ingredients here to repair things like repair complex. This is a complex of different types of peptides, fucogel, vitamin E, macadamia nut oil for that kind of conditioning agent, and of course, calming effect of bisabolol and camellia oils. So this is something that is definitely integral part of anybody's aftercare, whether they're undergoing some type of active treatments with you or a client's trying to manage their pigmentation at home. One of the most active ways to access pigmentation and to reduce pigmentation for your client is the Mela White Active C Serum. As the name suggests, it does have the presence of vitamin C, but there's also a presence of very potent brightening ingredient called Arbutin. Arbutin is a very similar molecule to hydroquinone. It's basically a molecule of hydroquinone with the addition of a sugar structure. So here you will notice that this is actually something that acts quite quickly on reduction of pigment. And there's also addition of urea. Urea is an overall skin conditioning agent that can help with the desquamation process naturally. So those are kind of the active ingredients in it. It is a serum. It is used under a present moisturizer or in addition to another product, but it is something that you want to land on the skin probably at the very beginning of your post-cleansing application. So when you're actually thinking about, well, how do we know it is effective, and how do we know that it will definitely work for me or my clients? Well, there's proven efficacy. Dr. Schrammek studies most of their products in affiliation with the Korea Institute of Skin and Clinical Sciences. And this is where most of the products are being studied on lucky individuals who are definitely going to not only be assessed by software-driven technology, but also by a means of questionnaires that they will fill out after using the product for a period of time. So if you notice over here, the results were quite fantastic. 96% of the women confirmed a brightening of their skin after just 8 weeks of use. So there's of course, other values here. I'm not going to linger on this, but of course, if you ever are interested in a full study, we do have that available for you if you're carrying the products, if you're using the products for sure. So Mela White Gel Mask is one of the newer additions to the realm of the brightening products here. This is a gel mask So it does give you that component of really kind of luxurious effect on the skin. So it's not just a brightening effect, but it also gives you an effect of hydration and kind of like an anti-inflammatory balancing effect. It is a very active mask. It feels almost like a burning, tingly sensation on the skin when it first, is landed on the skin. But of course, that sensation goes away, and it just shows to the effect of some of the ingredients. This is, of course, at no expense of any inflammation or redness in the skin. It's just the interaction between the product and the barrier of the skin. So this actually is something that's also equipped with an ingredient called Illumicine, and we will be looking at this ingredient a little bit more in detail later, but also soothing ingredients like panthenol and hydrating ingredients like the saccharide isomerate in there as well. So we do have something that is specifically for treatment of solar lentigines. As we noticed, we discovered this idea of Lipofusine as being the driving force behind creation of some of those lesions. Here we do have a Mela White Spot Duo, which is an overnight treatment. You can definitely kind of treat patch by patch. So the liquid is applied to the solar lentigines themselves. And then Super Beauty Mask is being put on top as an occlusion layer. That is left over the night. And of course, afterwards, it is peeled in the morning, and the client continues to the regular skincare regime for the daytime. So with that in mind, this just shows you exactly how to use it, and it is part of the consumer brochure. So this is something that clients can very easily get access to and really never forget how to use it. So let's look at some of those main ingredients that we had introduced. If you notice in the Mela White range, these are some of the products that we had discussed today. There is a slew of different type of ingredients here, including licorice root extract, things that you can recognize, antioxidant complex. There will be something like Fucogel, which enhances the anti-aging effect in the skin, and so on and so forth. But there are some of the specific ingredients I just want to linger on a little bit longer. And one of them is, of course, vitamin C and its derivatives. Dr. Schrammek formulates with 6 different forms of vitamin C very readily in the product. And here we, of course, have the kind of general effects of vitamin C as mentioned up on top. So skin brightening by inhibition of tyrosinase, activates the synthesis of collagen, of course, when it is exposed to the fibroblasts. And of course, another thing too, protects against free radicals. So we do have special vitamin C combination of active vitamin C and vitamin C glucosides, which are basically a way of sort of helping with the faster and more effective penetration and absorption into the skin. But the glucoside also is something that sort of preserves the vitamin C. As you know, vitamin C can be very volatile as well. It can be broken down or oxidated very, very quickly when it actually is exposed to air. So we also do formulate with ascorbyl palmitate, which is another form of vitamin C here. It is more of a stabilized format of vitamin C that is in many of the Dr. Schrammek product, predominantly in the Mela White. And there, of course, are other vitamin C's here. I'm not going to mention all of them today, but those are definitely the ones that are most carefully selected for the whitening range. So another ingredient that is very powerful is diacinamide. This is an ingredient that helps with the kind of melanin, or maybe interrupts the melanin transfer process between the melanocytes and the keratinocytes. And by doing so, it actually prevents some of the upper stratum of the skin layers being pigmented. So also helps to improve keratin synthesis, which is its secondary function here. And it also reduces some of the transepidermal water loss. So overall, it's a really, really powerful ingredient that, its functions definitely extend beyond just that of being an anti-pigmentation ingredient. Illumicine is an ingredient that had been very, very, carefully prepared here. It is actually a synergy of different type of ingredients like vitamin C, zinc PCA, which is kind of like the door opener for vitamin C, helps with its absorption, and oleuropein, which is an ingredient that definitely helps to break down some of the lipofusine in the cells of the skin. So definitely eliminating some of the best contributing factors to solar lentigines. So there have been some studies done with this ingredient as well, and you can see here that it's quite effective as it is actually applied onto the skin. This is, of course, in vivo studies on human skin. So Arbutin alpha Arbutin is actually the full name of this product. This is actually something that is not that hard to find or hard to get. It appears naturally in cranberries, blueberries, raspberries, and so on. Here, actually, we do have it because it is one of the more well-studied ingredients that definitely has been studied at medical level too. And it has been shown to have a very, very similar, if not comparable outcome to that of using hydroquinone. So Dr. Schrammek readily formulates with Arbutin in many of her Mela White products. So that is what we have as a kind of core aspect of the client's treatment. But of course, depending on the form of their pigmentation, there are other ways to help. So here we also do have a very powerful agent, of course, which Dr. Schrammek is very well known for if you are struggling with pigmentation. Sometimes the green peel can be also a great aspect to add into the sort of parameter of your treatment. So maybe treating with the active Mela White treatment, and then of course also proceeding to a green peel and kind of using that as an interchanging dynamic. The green peel has been shown to definitely elevate some of the more epidermal type of pigmentation. We also do have one product which belongs to the Beauty Elements line, and it is the Resveratrol Concentrate, which is a super antioxidant product. This actually is something that can restore some of the youthful functionality or the metabolic rates in your skin, also kind of prepping for the removal of excess pigment and kind of having a little bit of a positive effect also in interaction with lipofusine. We also do have the Sensicalm Ampules, which can be here used to, combat some of the inflammatory conditions that can lead to pigmentation. So this is something that clients can use as an SOS type of an idea. Clients who very frequently break out, and most of their breakouts will then transfer into some pigmentary changes in the skin. They can use this to mitigate some of the inflammation. And of course, for those of you that remember my talk here about melasma and the triggering factor of visible light, Blemish Balm, which is the #1 selling product in Dr. Schrammek across the board. Indeed, Dr. Schrammek was the inventor of Blemish Balm. Back in 1967 is where this formula was first launched. We definitely can filter some of the visible spectrum of light by using iron oxide and zinc oxide in particular in this product. So those are some of the really relatable pieces of information that you can share with your client. And then of course, in addition to products that can kind of directly affect how your skin manages the treatment of pigmentation or prevents pigmentation to begin with, additional aspect of products, of course, is always solar protection. And here we do have a presence of solar protect fluid, which is probably one of the most reached for type of products, and Sensiderm Sun Cream, which can be used for the more sensitive type of skins. Both of them feature 50 SPF range, and of course give you a little bit of a longer protection against sunlight. You do not have to worry about the ingredients here. Of course, they are formulating according to the European Union specifications, and they do actually are comprised of sunblocks such as, or some kind of filtering aspect as Ucelox, Uvenol, and Tinasorb. Those are some of the more modern sunblock technologies that are available on the market today. So having all of this in mind, of course, I do urge you to also contact us directly if you have any of the questions that will follow this session. We are, of course, located in Woodbridge, Ontario. This is Your Essentials. You can visit our virtual booth for more information, such as prices or information on the specific product. But this is it for me. And I thank you for your attention and thank you for spending these few moments with me. And I hope that you are going to have a great day. Thank you so much. Have a great day.